You require one procedural clinician, the stockinette, the small size for the thumb, 7.5 cm web or padding, 10 cm plaster of Paris, trauma scissors, cold water, crepe bandages and tape. Sit the patient with the elbow supported on a table. The elbow is flexed at 90 degrees. The forearm is neutral pronation or supination. The wrist is 20 degrees extension. The thumb apposition towards the middle finger. The interphalangeal joint neutral if included in the slab. For the cast, estimate the plaster length by laying the dry splint next to the area to be splintered. Use 8 to 10 layers. The distal margins are the distal palmar crease and below the interphalangeal joint of the thumb. Beyond the tip of the thumb for phalangeal fractures. The proximal margins are 3 finger widths below the elbow crease. Cut out corners of the backslab at the distal end. Ensure adequate analgesia. Clean and dress wounds as normal. Apply the stockinette to the arm beyond the margins of the plaster to allow for folding back. Cut a small hole in the stockinette for the thumb. Apply 2 to 3 layers of web roll beyond the plaster margins, tearing or cutting as it passes through the first web space. Ensure the bony prominences are well padded and the web roll overlaps itself by 25 to 50% with minimal creases. Submerge the pre-prepared dry backslab in water until bubbling stops and remove. Squeeze out excess water, smooth, and apply over the radial aspect of the forearm and the thumb. Turn back the padding around the distal and proximal margins of the plaster of Paris. This allows for further moulding to the patient's anatomy. Apply crepe bandage firmly over the slab and fasten with tape. Note the technique around the thumb and first web space of cutting partially through the crepe bandage and rotating, allowing it to be held in place around the thumb. This secures the plaster of Paris in position. Once secured, further moulding can occur over the top of the crepe bandage, getting better approximation to the anatomy.